Okay, so this video is to help with improving internal rotation. Oftentimes, it's necessary to be able to establish internal rotation for your shoulder, not only to get behind your back, but be able to have normal linear movements of your arms for daily living. After injury and or surgery, it can be difficult to initially get the hand behind back. And so strategic ways of how we can work to improve upon that would be finding subtle ways in the front of our torso. So first, it's important to identify that if I continue here and I was able to magically bring my forearm through my torso, the internal rotation would continue around my back. Thus, in order to achieve this, we need to improve the internal rotation in front. So one way that you can do it is if you strategically cross your arms. So if it's my right arm that I need to increase my internal rotation, crossing my arms is going to put me into that relative position where I can buttress the arm out with my left arm. And that's going to actually induce a little bit of a stretch through the front and a little bit through the posterior capsule. Once in this position, I can not only just sustain that to build the tolerance to tensile loads within the joint capsule, but I can also induce further biological changes within the joint capsule by adding contractions. So the prescription would be hanging out for 1 minute in a slightly internally rotated buttress position with my wrist. After that, my resistance would be pushing out against the resistance of my left arm. And I want to be really deliberate about trying to contract the tissues on the back side of the shoulder in order to do that, rather than just getting an obligatory glide with deltoid activation. So it would look like this. Again, it's going to be unremarkable from the standpoint that it's going to be an isometric, but my goals are to gradually ramp up the intensity of my contraction, trying to pull my arm out away from my body for 30 seconds. I start at 10, 20, 30% max effort, gradually ramping up as much pressure as I can against my left, using the back side of my shoulder. After the 30 seconds, I'm going to then try and compress or internally rotate my arm further and push into my torso. And it's going to feel weird because you're not going to actually go anywhere, and you may actually even feel weak in that position just because you haven't been there or have done that before. Again, the sensation is going to be some general tension around the arm. I push as hard as I can, 30 seconds, and then release.